Many have dreams to be a medical professional. When choosing an institution for medical school, a lot of things matter. The quality of the academic and clinical programs, as well as the clinical experience. At UNIMAS, we offer that and more. A supportive culture, a vibrant community, diverse student and patient population, all set against the backdrop of Kuching and Kota Samarhan.
The culture here is welcoming. It is a big family. Everyone wants the next person to succeed together. We want our students to reflect back to the society and the community today. As a community-driven university, we believe that immersing themselves and ourselves in the diversity, it creates better innovation and greater creative achievement.
In UNIMAS, there's not a culture of a competition here, but a great environment is what we all strive for.
Everyone is committed to create a great environment to become a great doctor in the future.
Our patient population in Malaysia is remarkably diverse. Different languages and dialects will be something that we face every day once we become a doctor. So, getting to know this and learn it now make us to be more appreciate and respect. It just set us up to become a better doctor for the future.
From the beginning of the program, 25 years ago, we have adopted a spiral curriculum. As the students advance forward into their years of clinical study, we connect everything back to underlying basic biological sciences. We connect and revisit every aspect of human health, from emotions to diseases, back to its basic biological sciences.
We are introduced to clinical setting early in our curriculum. The exposure gets more as we advance through the year. It was very daunting at first, as a first-year student, to step into hospital and seeing patients. But at the same time, it's really an exciting experience.
We are committed to excel in nursing education, research, and practice. It views health as a complex
Many have dreams to be a medical professional. When choosing an institution for medical school, a lot of things matter. The quality of the academic and clinical programs, as well as the clinical experience. At UNIMAS, we offer that and more. A supportive culture, a vibrant community, diverse student and patient population, all set against the backdrop of Kuching and Kota Samarhan.
The culture here is welcoming. It is a big family. Everyone wants the next person to succeed together. We want our students to reflect back to the society and the community today. As a community-driven university, we believe that immersing themselves and ourselves in the diversity, it creates better innovation and greater creative achievement.
In UNIMAS, there's not a culture of a competition here, but a great environment is what we all strive for.
Everyone is committed to create a great environment to become a great doctor in the future.
Our patient population in Malaysia is remarkably diverse. Different languages and dialects will be something that we face every day once we become a doctor. So, getting to know this and learn it now make us to be more appreciate and respect. It just set us up to become a better doctor for the future.
From the beginning of the program, 25 years ago, we have adopted a spiral curriculum. As the students advance forward into their years of clinical study, we connect everything back to underlying basic biological sciences. We connect and revisit every aspect of human health, from emotions to diseases, back to its basic biological sciences.
We are introduced to clinical setting early in our curriculum. The exposure gets more as we advance through the year. It was very daunting at first, as a first-year student to step into hospital and seeing patients. But at the same time, it's really an exciting experience.
We are committed to excel in nursing education, research, and practice. It views health as a complex and dynamic, and the client as a holistic individual. Students in this program learn in an environment that stimulates intellectual inquiry and creativity, which encourages them to be problem solvers and lifelong learners.
Here, we learn how to care, to serve, and to help. We went from zero to hero.
I really cannot pick a better place to learn and become a greatness. This is a place that belongs to my heart throughout my journey.
Come do research with us.
Come and join us at UNIMAS and realize your dream.
Okay, Assalamualaikum and good morning to esteemed guests and honored participants. I am delighted to welcome you to this Faculty of Medicine and Health Sciences Special Guest Series 2023 Pre-Symposium Talk this morning with the title Promoting Effective Interprofessional Education for Collaborative Practice, Cultivating Strong Partnerships and Improving Outcomes in Healthcare. So before we start, I would like to introduce our special guest, Dr. Saraswati Thangaraju. Good morning, Dr. Saras.
Morning. Good morning.
Okay, Dr. Saraswati is currently working as a senior lecturer in University Malaysia Sarawak. She has vast experience of more than 25 years in teaching, management, and conducting trainings in nursing. And Dr. Saraswati is a PhD holder in nursing from University Putra Malaysia and Master of Educational Management from University Malaya. And she started working as a staff nurse in 1993. And in 1999, she worked as a clinical instructor in Pantai Nursing College. She has published papers and conducted trainings related to nursing at various hospitals. And her research interests are interprofessional education, infection control practices, and hospital quality management. So without further ado, let us begin this session.
Good morning. Good morning all. Thanks for joining us today. I'll share my screen now. Okay. So can we start now, Vaizu? Yeah. Right. We had already made an announcement that we are going to we are organizing a symposium on interprofessional education in December in UNIMAS. Now, prior to that symposium, now we are having this pre-symposium talk. It's rather an interactive session just to introduce what is this interprofessional education is all about. Why are we advocating for this interprofessional education, and how is the contribution towards collaborative practices? So let us look at what are the points that we are going to put forward to you all to think about this more seriously. So we all working in the hospital-based healthcare centers. We see many kind of many different healthcare workers. We have doctors, nurses, we have pharmacists, x-ray people, and we also very importantly here, the healthcare facility management staff. So who is the most important healthcare worker? Right. How many of you will say it's doctors? How many of you will say it's nurses? How many of you will say, it's pharmacies? So, nevertheless, can the hospital function without any of them? Yeah, COVID has come and it has actually shown the world how is the contribution of each healthcare workers is important in terms of patient care. So can the hospital go one day without the facility management staff? I mean, we always call them cleaners. So I'm putting it as facility management staff. So what about the doctors, nurses? So at the end of the day, who is the captain of the ship? So we always say that Pengarah Hospital is the captain of the ship. So, well, each staff, when a ship is going on, each staff has to contribute. And let us see who is the captain of the ship at the end of this talk. Right. So let me put some definition here. What is interprofessional education? Interprofessional education, interprofessional learning, the terms are actually the same. It has been used interchangeably, yeah? So occasions when members or students of two or more professions learn about, with, and from each other to improve collaboration and quality of care and services. So when there are opportunities for them to learn together and from each other, and this is what we call as interprofessional education or interprofessional learning, right? So let me introduce IPE. Parallel to the global medical education wave of learning together to work together for health. Kindly take note, yeah. This has been advocated by WHO in 1988. And today, 2023, we are trying to advocate this again, particularly in this region. This is a very important thing, and COVID has actually brought up the important, how important is this learning together to work together. Now, encourage learning from each other and other HPs focusing on patient-centered and safe best practices. It also inspires safe collaborative practices among the healthcare professionals when they learn with, from, and about each other. So the key word is learn with, from, and about each other. So the point is to provide team-based patient care. And this is a key issue to be addressed in Malaysia, a key challenge in Malaysia in incorporating the current profession-specific medical education to interprofessional education curriculum. Now we are talking about a curriculum, interprofessional education curriculum, right? Why? And, we all know that nurses have their own curriculum, doctors have their own curriculum, pharmacists will have their own curriculum. But at the end of the day they pass out, the next day, all of them have to come and work as a team in the hospital. So that's where the current profession-specific medical education need to be reviewed to interprofessional education curriculum. Let's see. Right. Now, we are talking about CAPE. CAPE is a Center for the Advancement of Interprofessional Education. It is based in UK. Yeah, in 2011. Again, yeah. Now we are in 2023. So UK has already established it in 2011. The Interprofessional Education Collaborative Experts Panel, IPECP, established 4 interprofessional education core competency domains. So domain number 1 is ethics and values for interprofessional practice, roles and responsibilities, IP, interprofessional communication. Now, we all talk about communication. So what is new about this interprofessional communication? Teams and teamwork, right? Let us see, each IPE domain has got subdomains. So let us see, I'll just share with you all some of these subdomains that, it might be your concern to look at it as medical educationists, medical practitioners. So for values, ethics domain, yeah, look at the sub domains here. And I want to just highlight a few here. Yeah, respect the dignity and privacy of patients while maintaining confidentiality in delivering team-based care. Embrace the cultural diversity, which is very important for, particularly for Sarawak, right? And look at VE6, yeah, values and ethics 6. Develop a trusting relationship with patient families and other team members. Yeah, so we will look at it. And VE9, act with honesty and integrity. Yeah, so we will see the second one. What about the roles and responsibilities? Here again, yeah, we have to communicate one's roles and responsibilities clearly so that in the hospital, it is doctor's job, it is nurse's job, but we need to communicate very clearly to avoid any misunderstandings. And we also recognize one's limitations in skill, knowledge, and abilities, right? And here, RR6, yeah, roles and responsibilities 6. Communicate with team members to clarify each member's responsibility in executing components of a treatment plan or public health interventions. So here, we're actually forging interdependent relationships with other professions. So we will, these are the subdomains in roles and responsibilities, but how to make the healthcare professionals understand their roles and responsibilities when we only have profession-specific curriculums? They all learn separately. How you expect them to understand each other's roles and responsibilities? How are they going to correct each other? They need to understand each other's roles and responsibilities. Then only they can correct when the other person is not following the proper procedure. Otherwise, they cannot correct each other. So there's a very important aspect here that has been highlighted by CAPE. And we also look into specific interprofessional communication competencies. Communication has been a very hot topic. People always talk about it. Communication skills. So, but in interprofessional communication competencies, what are the things that we are looking at? All right. So C4, listen actively and encourage ideas and opinions of other team members. With such a chaotic, busy ward environments, current work environment? Do all the healthcare professionals have the time to listen actively and encourage ideas and opinions of other team members? Or give timely, sensitive, instructive feedback, yeah, to others about the performance? So instructive feedback is the key word here in interprofessional communication, yeah? And use respectful language. Are we still having situations where healthcare workers shouting at each other, scolding each other? Yeah. So these are the things that we need to look into it. And CC7 recognize how one's own uniqueness, including experience level, expertise, culture, power, and hierarchy within the healthcare team. Now, hierarchy is one of the major issues. Many papers been published in interprofessional education, interprofessional learning, and they all found that this hierarchical status in the hospital is one of the biggest barrier for interprofessional communication. Right, I'll talk about it more after this, yeah? And then teams and teamwork competencies, yeah. This is where, you know, the COVID has actually highlighted the teams and teamwork competencies, how important it is for our healthcare professionals to come as a team, particularly in terms of when there is emergencies, when there is disasters, yeah. So we need to train them from students how to come in as a team and teamwork. Right here, you can see some of the things, the subdomains here. Integrate the knowledge and experience of other professions appropriate to the specific care situation. Yeah, how? For example, yeah, I have done a small work on this where we put dietetic students and nursing students to go and do, we had an interprofessional learning session. They did their assessment on a patient, a very ill old patient, and the nurses do the nurses assessment, and the dietetic students, they did the dietetic, their nutritional assessment. The nutrition students, they did their nutritional assessment. But however, that patient has got a CBD, continuous bladder irrigation, and it was nutrition, yeah, nutrition students, they don't know how to turn the patient with the bladder irrigation on. So the nursing students actually taught them how to do it, how to clamp the tubing, the bladder tubing before turning. And they also explained to them how it can actually cause injury to the patient. So that's how they learn, they share. And they were actually at the end of the session, both sides was very happy because when they presented the assessments, they learn, they understand each other's rules. So this is a very important thing that we need to look. And I want to share with you all, yeah. Share with you all. In my PhD study, what we did is we took this interprofessional education, all these concepts, and
recording stopped.
And there are certain
recording
areas,
in progress.
Certain areas that we can put them together. We know we have profession-specific curriculums, but what are the areas that we can actually bring them together? So one of the things that areas that we can bring them together is hospital-acquired infection control practices. Now, all of us will agree that the doctors, the nurses, the entire healthcare professional team have to do their hand washing following the hospital protocol. They have to do how they are supposed to use mask, how they are supposed to don and take out their mask, gloving. Any of them make mistakes, any of them not following this protocol, definitely going to cause infection, cross infections to the patient, also nosocomial infections to the patients. So we just took that, we created simulated scenarios, and we managed to get doctors and nurses to come as a team. We put one doctor and one nurse to practice on that simulated scenarios. For example, they have to do take blood. Yeah. So how the doctors and nurses must work together, assist each other, following all this gloving, hand washing techniques. So we do this kind of practice, and we came up with checklists. We came up with checklist interprofessional. Now, all of you, you know that we have OSCE examinations. So normally we do OSCE examinations. We have checklists. We just go to the procedure, you know, confidentiality, blah, 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 blah. We mark them. But here, in that checklist, we inculcated this interprofessional education domains that I discussed just now, the 4 domains, and we look at how they work together. And for the first part, we published 2 papers here in British Medical Education, that is Q1. And the first part, this is a baseline data. We whatever the numbers of doctors and nurses that we have got, we just look at them, we gave them the questionnaire, and we look at how is their baseline data at the point that they enter this study, this research. So let me share a little bit on this. The objective of the study was to determine the significant differences in self-assessment, attitude, and perception of interprofessional learning among doctors and nurses in a teaching hospital in Klang Valley. And is there any significant difference in the selected demographic factors, mean and total scores between doctors and nurses in self-assessment, attitude, and perceptions of interprofessional learning aspects? So these are the objective of the study. And a little bit on the literature review. Yeah, when I was doing, PhD students have to do a lot of literature review. And I came across somebody has written about this doctor-nurse game. I was thinking, hey, what is this interesting thing about doctor-nurse game? And this actually, I started searching for this article. I really had a hard time to find the original article. I have to get the librarians to come in and help. In fact, I still remember I was searching for this article at 4 o'clock in the morning, 1967. I'm not even born, so it was quite frustrating for me at that point. I'm not even born 1967. So this paper was written by Dr. Stein Leonard. Dr. Stein, he said that the establishment of professional collaboration between doctors and nurses gained attention ever since the publication of the hallmark article by Dr. Stein. The doctor-nurse game. Just briefly on what is this doctor-nurse game is all about. All right, the doctor-nurse game. These professions demand intense mutual respect and cooperation between the team members. However, the stereotype attitude toward nurses as the handmaiden of male doctors creates serious resistance to effective communications between them, as the doctors seek information about patient progress, and from nurses, the doctors do rounds. Where are they going to get the information about the patient? They have to ask the nurses. The nurses have to tell them how is the patient today, patient B or patient Ed, what they had, yes, fever. So all the information has to come from the nurses, all right? But the nurses need to be, though at that time, because of the stereotype attitude, the nurses still need to be bold and have the initiative to make momentous recommendation, but they need to appear passive. This was in the scenario in 1960s, yeah, 1967. However, in 1990, Dr. Stein and his team, they revisited the doctor-nurse game. And then, by then, in 1990s, people are already talking about PhD in nursing. In the Western countries, they established all this already. They have bachelors, they have masters, they have specialization, they have PhD in nursing. Then this team come back and revisited. And they said, hey, look, they recognize the evolution of nursing practice as a profession parallel to other healthcare professionals. By then, the pharmacies, pharmacies are also established. Even when you look at occupational therapy, physiotherapy, so X-ray, so all the other professions is already established. So the author's opinion became debatable. So many studies was reported. Then people start doing a lot of research on this area. And there is a need for greater dialogue, as all healthcare professionals are experts in their field and need to collaborate for the good of the patient to maintain safe practices. So they started recognizing that everybody is important. So here barriers again, yeah, the barriers here in interprofessional education is hierarchical questions often result in significant barriers between seniors and juniors, yeah, between one profession and the other profession. Yeah, the hierarchical questions, as a staff nurse, when we qualify, can we go and tell the senior staff nurse, you have done something wrong today, I think you shouldn't have done it this way. No junior nurses will dare to go and tell a senior nurse. Yeah, even if you're working in a new place, yeah, even though you're a senior, but you will not dare to say anything to anybody because you are still considered junior. So the juniors and seniors is one of the biggest barriers, hierarchical questions. So this is still a big issue area to be addressed. We cannot deny that this is a real fact, what's going on. Yeah. And many people, yeah, they have many papers been published on this area. And it can lead to stress, burnout syndrome. People can get frustrated working in an institution where they feel they don't feel like respected. As it is, it's already shortage of nurses everywhere. People will start leaving the profession. And we are also listening nowadays that we are listening, suicidal attempts by even Oxmans, yeah, things like this. So it's the stress, the burnout syndrome, yeah. So all these, what are the contributing factors into all this? So seniority often creates obstacles to the formation of interprofessional collaboration among doctors and nurses. Nurses find junior doctors were generally very open. Yeah, I think this is another thing. And so again, another debate that is going on in Western countries. They're very established, in UK, in Canada, and Canada has got their own framework, interprofessional framework. WHO has already published the interprofessional education framework. Yeah, and what is the most effective period to introduce the principles of IPE in the curriculum for training? So still debatable and varies across different institutions. Right? But that's some of the literature reviews. And what is the significance of this study? Doctors and nurses in the current study had undergone their training in traditional profession-specific programs. What we are having now is traditional profession-specific program. And there is little evidence to show that they have formal exposure to IPL in their training. All healthcare professionals to be clear and know the value of IPL. They need to be trained in IPL approach as they are also supervising students in clinical areas to minimize the gap in IPL approach. All right, the method that we use, a total of 39 doctors and 37 nurses. They were recruited for an interventional study. And we use this University of West England Interprofessional Questionnaire by Dr. Pollard and et al. And yeah, all the other ethics approval, we managed to get it done. So there are 4 dimensions, yeah, in IPL aspects, interprofessional learning aspects, self-assessment and communication and teamwork. Interprofessional learning, interprofessional interaction, interprofessional relationship. The Cronbach alpha was 0.79. All right. The questionnaire, briefly on the questionnaire, you get subscale 1, scale 1, scale 2, scale 3, and scale 4. They have this scores. We look at whether it's positive, neutral, or negative. So all whether CTW, interprofessional learning, interprofessional interaction, and interprofessional relationship. Now, please pay attention on this interprofessional interaction. What is this interprofessional interaction? How it differs between interprofessional relationship, interprofessional learning? So I just show you some items, yeah, example of items just to differentiate so that you can understand what is this questionnaire is all about. So for communication and teamwork scale, they just do their self-assessment, yeah. For example, I feel uncomfortable putting forward my personal opinions in a group. Yeah, they feel they feel that are they comfortable putting forward their personal opinion? No, I prefer to stay quiet when other people in a group express opinions. Now, this is happening, particularly in our younger generation of staff. They feel that they are scared. They might be get scolded. They will feel embarrassed to give opinion. Yeah, we are different. We are in this university. So we encourage students to come and present and give opinions, but in the real life situation, in the hospitals, in the healthcare center, what is happening? So these doctors and nurses are not students. They are actual doctors and nurses who are working in that teaching hospital. All right, they're trained staff. So we ask them to assess themselves on this. All right. And then we look into interprofessional learning scale, so the subscale per se. So they look into my skills in communicating with nurses, vice versa. The doctors will answer with the nurses will answer with doctors. So the nurses will answer, my skills in communicating with doctors would be improved through learning with them. So we just want to know, do you think by learning with them, your skills will improve in communication? So like item number 25 here, collaborative learning would be a positive learning experience for all doctors and nurses. So actually clinical area gives us a lot of opportunities to learn together. Yeah, so we can actually organize a small group interprofessional learning, such like what we did last time. Yeah, we did it in the hospital between the dietetic students and the nursing students. Also, we take a patient, real patient, and we did that assessment and the entire session. Yeah. And then what about this interprofessional interaction? Yeah. Okay. Doctors and nurses have stereotyped views of each other. The line of communication between all members of the doctors and nursing profession is open. Yeah, the line of communication between all members of the doctors and nurses professions is communication. So the line of communication, and then number 31 is the status hierarchy. This is the one we really an issue with that we found, and the biasness of views of each other. So these are the issues in interprofessional interaction. We need to pay attention on this because people need to understand how it differs. Because normally when we say interaction, we think of communication. Actually here, interaction, they put it separately. These are the things. All right. And what about interprofessional relationship? Again, I'm confident in my relationships with people from nursing disciplines. Same goes vice versa. I'm comfortable working with people from medical discipline. So I feel that I'm respected by people from nursing discipline. I lack confidence when I work. These are all interprofessional relationship scale is all about. So the results, yeah, the demographic findings. What I want to highlight here is this part, yeah. Have you attended IPL training before? We asked the doctors and nurses. Surprisingly, yeah, we had among the doctors, there were 6 of them. Among the nurses was 15 of them. They did previously attend. So we asked them, where did you attended this IPL? So the doctors, the IPL sessions before this is they all trained overseas. So they studied in Western countries. So they have apparently attended this IPL training. And the nurses, they told us that they attended this IPL during their post-basic, their specialization. So that means some of our specialization courses already exposing the students. Yeah, this is from our finding. And no is quite a number of them, 33 doctors and 22 nurses. Yeah, they didn't. Anyway, these are the results, indication scores. Again, yeah, you can see the IPI, the interprofessional interaction, is the lowest compared to the others, right? And a majority of doctors got positive in CTW, IPL, IPR, and neutral. Nurses' highest positive score was in CTW. And in IPI, it was neutral. Yeah, 51.4%. And here also the neutral IPI. So there was a significant difference between doctors and nurses in IPL attitude and no significant difference in other dimensions. So the mean scores, we looked into it. And okay, again here in IPR, there was no significant difference between doctors and nurses. And there was only one significant difference in IPL. There was a significant difference in IPL dimension. Right. Again here, the point that I want to show you all today is here. Though the number of doctors and nurses who have attended the IPL session is small, all right? But here you can see that the IPL session attendees mean score was more compared to the non-attendees group. And there was a, we can see some difference here. Right? So discussion on the findings, doctors and nurses differ in their communication skills. Although they are required to work collaboratively, doctors showed a higher inclination towards communication skills compared to nurses through learning with each other. So nurses prefer to stay quiet when other people in a group express opinion of disagreement. And this is something very alarming here, you know, because the nurses has to play a very active role in giving opinion regarding the patient care. When when these findings are from Malaysia, you know, this finding is from our current setting. Compared to when we look at the Western countries, the nurses have more voice. They can, you know, express whatever their disagreement. All right. And also other healthcare professions, yeah, they can communicate, they can have discussions. Yeah. Communication among healthcare professionals is mandatory to deliver safe healthcare. Inequality shown could cause serious consequences, particularly when they are reluctant to express opinions.
Hi, Dr. Saras.
Yeah.
Currently, there's no video of you. Maybe you turn off your webcam.
Oh.
I cannot see.
No, I didn't. I didn't.
Yeah, because it's black. Yeah.
No, I didn't do anything.
Okay.
Shall I stop sharing and come back or what?
Not sure. Or maybe...
Can you hear me then?
Yeah, I can hear you. Okay. Just no video.
I really don't know what happened.
Okay. Maybe you try stop video and then you turn on back. Is it okay? Don't stop sharing. Just stop the video.
Okay.
Yes. Okay, you're back. Sorry for interrupting.
Thank you anyway. Okay. All right. Okay. Accidentally. Can you see me? Okay. Can. So, however, in this study, more nurses agreed that they had equal respect in each discipline they worked. It is depicted in previous studies that doctors and nurses need to portray mutual respect to avoid impairment in collaboration at work. So these are all right. So our conclusion is the findings reveal IPL training improves attitude and perceptions towards collaborative practices among healthcare professionals, which we further proved it, yeah, the effectiveness of it when we really did that intervention and we published our second paper. We created a module on this. So we did the interprofessional education module on hospital-acquired infection control practices with simulated scenarios. And we proved the effectiveness. It was an interventional study. The doctors and nurses came together. We had a couple of sessions. They practiced on the simulated scenarios. And then they also practiced on basic hand washing, masking, gloving, all together. And they practice, and after 3 months, they come back, because the retention period is 3 months. And we put them together again. It's one team, one doctor, one nurse into one simulated scenario. And we actually implemented this module, yeah, and we proved that effectiveness of this training module. And I passed my viva voce and I got my PhD. So that paper was published. Second paper was also published in BMC Education. It's Q1. So to know more details about that module, how we did it, what are the things we do it, please come for the symposium in December. So we will give you more information on this. Together, yeah, we will tell you, I will tell you a little bit about the speakers. So what are the examples of IP in healthcare? You can do on hospital-acquired infection control, because the HPs have to learn. I mean, we can correct each other. When you see one of the healthcare professional is not doing proper hand washing, so being a junior person, can you go and correct? Can you please do it properly? Are we going to be like watchdogs? I watch you, you watch me. Otherwise, we are going to have more nosocomial infections in the hospital. So these are the references, and then these are the contributors, my supervisors, and all that. I will share with you all now the symposium. Yeah, this is the symposium. Let me talk to you all regarding these speakers. Prof. John Emeritus, Prof. John is from Canada. He is one of the founders of Canadian Interprofessional Education Competency. He is coming all the way from Canada. Is now attached to University of British Columbia. He also sits with WHO, Interprofessional Education. And he was actually, I didn't know about it, UPM has sent my thesis. He was my external examiner. So that's how after that only, of course, students, we won't know our examiners. Only when the results came, his report came, and then only I know that, yeah, he was my external examiner. And Professor Dato Sivalingam Nalaya, maybe some of you know, he's very well-known professor in gynecology, was also the former head of ONG in Malaysian Kementerian Kesihatan, Malaysia. He is now in IMU. He was the key person in my study. He took me through from the very first
Recording
day
stopped.
Panel. In
Recording
this.
in progress.
In fact, when we wrote this paper, he was the key person who actually helped me to draft the paper and get it published. And Dr. Jalina Karim, together with Prof. Shafinas and Dr. Rosliza, they are my supervisors. Dr. Jalina is currently the head of nursing in UKM. She was the first one, to actually go and get a PhD in interprofessional education. Otherwise, I wouldn't have the supervisor, Malaysian supervisor here. So in interprofessional education, so all, and I'm a student for all of them. Yeah, I'm a student for all of them. And they wanted me to show the interprofessional education module that we have done, which I'm also one of the speakers. And you can look at it. Don't miss this. Professor John will be talking about what is interprofessional education and collaborative practices. What is the framework? What is the theory? And many universities. In fact, I was told by a colleague of mine, a daughter studied in UK. just because that university don't have nursing program, they sent this medical students to another university which has a nursing program just to get the interprofessional education sessions, so that much they are doing in overseas. So we are still educating, introducing interprofessional education. I hope, after this, my colleagues here in UNIMAS from all areas, psychology, social, Dean is very keen about social worker department. Yeah, everybody must come together. Prof. Asri is very keen to promote this interprofessional education in UNIMAS. And yeah, Prof. John is going to be here, and Prof. Datu Siva will talk about importance of developing interprofessional and incorporating it. He is a very renowned medical educationist, and so he will talk about it, and Dr. Jalina also will come and contribute. And we are also going to have interesting group work, unlocking the potential of can't see am I not sharing?
Yeah, I cannot see the brochure.
Why you didn't tell me? Okay, yeah, can I? Yeah, right, can I? Can see you? Yeah, I'm so excited. I didn't share. So, okay, you all missed this. Okay, this is Prof. John Emeritus, John Gilbert, and this is the Professor Datsunalaya and Dr. Jalina and myself. So I'm a student for all three. I'm connected, my examiner, my expert panel, and my supervisor. And I was very excited when Dr. Jalina told me, you better go and present your module, since it has already been proven. So it's quite exciting. And all of them, they said, okay, time for us to advocate IPE in Malaysia. And Prof. Asri has given a lot of support on this. And I sincerely hope, to get some participants. It's not easy to go and get somebody from Canada to come all the way to UNIMAS, actually. So, and he sits with WHO. So we can look into more research. We can look into this. Is the brochure. Yeah, we have been circulating this around. And it's good if you all can come face to face, because we can have we have two interactives. We have day 1 and day 2. Okay, day 2, and I'll be presenting in day 2. Day 1, still Prof. John will be talking about how to do interprofessional facilitation. So I asked him for this session. I requested when we had our meetings. I said, Prof, can you, because they have interprofessional facilitation programs, they are training people how to become interprofessional education facilitator. So he said, oh, that's a long process. I said, okay, never mind. At least you tell us something about it. I insisted for this session. All right. And it's also established in Australia, New Zealand. Yeah, they all have it ready. So we are very much, we are not talking about it. And now I'll show you all the module, and I'll show you all what are the sample of the simulated scenarios that have been created. I'll also show you some pictures, the actual doctors and nurses, how they come and do these sessions. Yeah, it's all on evidence base. Yeah, and we also will have a brainstorming session on how to. They are here to facilitate us, to tell us how to go about it, and some new areas there where we can explore together and look into research areas, collaborative practices. You can actually go and check, find a lot of papers already been published in this area. And before I end my talk, we are going to go, they are going to ask for question and answer. Pardon me if any of these things that I'm telling you all today is known to you. I just wish to share my experience, and pardon me if I've given you something that you are known. Right, can I stop sharing, and you want to go for, do you want me to stop sharing? And Want to go for Q&A?
Yeah, okay.
Okay, right.
Okay. Thank you so much, Dr. Saraswati, for the brilliant talk. So now we can start the Q&A session. So if there's any question from the participants, you may write your questions in the comment section. Yeah, it's either in Facebook or in YouTube. Okay, while we wait for the questions, Dr. Saras, I have one question for you. Let's say if in UNIMAS, if we want to implement the interprofessional education, so how can we do it?
Right. Elective subject. It's an elective subject. 1 or 2 credits. Yeah. So that's how they do it in overseas. They do it as an elective subjects. They put them together. It's exciting, you know, when you get this multiple lecturers to come in, we discuss. When are we going to have some time? We are always busy, right? Year round, we are busy. All right. Everybody will say, oh, we are busy. So normally they do it as an elective subject. They put this certain medication error is one of the areas. A&E, yeah? Your CPR. CPR is interprofessional. You can do it as yeah, you know, you have to put them together and learn how to go and help the patient. Yeah.
Okay. Is there any more questions from the participant?
It was a tough journey, not easy to go and get these doctors and nurses who are actually working on the field. It's all about they're busy, they shift work, and each session I have to run 3 times, you know, 3 times to get them to come in. Different shift, different people, and carrying things. It was done in Hospital Serdang to get the booking for their simulation center. Dear. Just a little bit of a clue for those who intend to do a PhD research topic. One of my previous lecturers in UPM, he said, you choose a topic which has happened before, happening now, and will happen in future. Then you are safe. So infection control, hospital-acquired infection control is happened before, happening now, and nobody can say it will never happen in future. So interprofessional education is also the same. All right. Everybody has to work as a team before. They have to work team now. And even in future, you have to work as a team. Nobody can run away. So when you pick up these kind of topics for PhD studies, you know, actually you are safe. Nobody can say in 10 years time you're outdated. Nobody can say, because you got to like outcome-based education, OBE. At one point now, countries are already moving away. It's considered obsolete already. So that's what I read. I read somewhere. They're already getting, so then the new things will come in, right? So, but to be safe, it happened before, happening now, and it will happen in future. Then you're safe. Your research is, people will be keep going and citing you, citation for you. Right.
Okay. Thank you so much, Dr. Saraswati. Okay. So for participants, kindly check the comment section on YouTube and Facebook for the attendance link. Thank you so much for your participation in this talk, and hope to see you all during the symposium soon. Okay. Thank you.
Right.
Okay. Thank you
so
again,
much.
Dr. Saras.
Thank you all. Parashida, Waisal, and the team. Thank you so much. Thanks to the participants. Thanks for your time. Hope to see you all on December, yeah?
Yeah, hope to see you all in the symposium.
Right. Okay.
Okay, bye.
Bye-bye.